Good morning, students. Today we'll be studying about the front, back and adductor compartments of the thigh. This is Dr. Yusuf from Al University. These are the specific objectives related to this topic which are covered in the Al University in different sessions like the PBL sessions, lab, lectures, seminars and STLs. So these are the nine topics, nine specific objectives which are related to this topic. To begin with, the thigh. The thigh is the region which extends from the hip joint to the knee joint. So it extends from the hip joint here to the knee joint. This whole area is called as the thigh. So this thigh, if you see the cross section, it is taken in the cross section, this is how it looks like. Okay, so when we see the thigh, and for the simplification of the study, we divide it into three compartments, that is the anterior compartment, the posterior compartment and the medial compartment, and these compartments are separated by a modified deep fascia which invaginates inside between this compartment. This is called as the intermuscular septum. Intermuscular septum separates these three compartments. So intermuscular septum is nothing but the modified deep fascia which is present between the compartment. So the largest compartment here will be the anterior compartment, and there is a posterior compartment and a medial compartment. Always when you study the upper limb as well as the lower limb, you should keep on comparing the upper limb with that of the lower limb. If you see the upper limb, the thigh is related to the arm, and in the arm also we see there are three compartments, even though there is an anterior compartment which is called as the flexor compartment and a posterior compartment. There is also an additional compartment, very small compartment formed by the muscle coracobrachialis. So the presence of the coracobrachialis on the medial side indicates the medial compartment, which is very similar to the thigh where we have the three compartments. To begin with, we'll study each compartment one by one. The first compartment is the front of the thigh, which is also called as the anterior compartment, or it is also called as the extensor compartment of the thigh. If you recall, in case of the arm, the anterior compartment is also called as the flexor compartment, but here the anterior compartment is extensor compartment. So this anterior compartment in case of thigh is supposed to be correlated with the posterior compartment of the arm, that is the extensor compartment of the arm. Why? This is because if you see actually during development, the arm has rotated outwards by 90 degree and the thigh has rotated medially by 90 degree. So it is totally opposite to that of the upper limb. So in case of the upper limb, the arm, the posterior compartment is extensor compartment, but here in case of the lower limb, that is the thigh, it has totally rotated, so the posterior compartment has come to the anterior compartment. So actually the anterior compartment is the extensor compartment in case of the thigh. So this the muscles in this compartment extends the knee. You should remember, if it is the extensor compartment, it extends the knee, not the hip joint. It extends the knee joint. That is the thing you should remember. Okay, so this compartment extends from the, as I said before, it extends from the hip joint to the knee joint, and it corresponds to the back of the arm. As I said, the back of the arm or the posterior compartment of the arm. Now we'll study what are the muscles which are present in this compartment or the front of the thigh. The first muscle is the Sartorius muscle. So if you see here in this picture, there is a muscle here which is also called as the talar muscle, long strap-like muscle which extends from the anterior spine. Here it has been cut to see the deeper muscles here, so actually it will be complete. It will be a complete muscle which extends from all the way from here up to the beyond the knee and go up to the tibia. So this is the first muscle, which is also called as the Sartorius. Here we, on the other side, the same arrangement of muscle have been shown with the cross section. So here there is cross section, so you can see all the muscle and you can see the three compartments. This is the anterior compartment here, this is the medial compartment, and this is the posterior compartment. Okay, so what we are studying are the muscles in the anterior compartment. The first muscle here is the Sartorius. So here will be the Sartorius on the medial side. Begins from the lateral side, goes to the medial side. We'll study this again in detail later. First, we'll name what are the muscles which are present in this compartment. The first one is the Sartorius, as I said. The second is called as the Quadriceps femoris. Quadra means 4, ceps means heads. So it has 4 heads. So this is called as the Quadriceps femoris. If you recall, in the gluteal region, there is also a muscle called as the Quadratus femoris. So you should remember, you should be able to differentiate between the Quadratus femoris and the Quadriceps femoris. Quadratus femoris is present in the gluteal region, and the name Quadratus has come because of the quadrilateral shape of that muscle. But here, this in case of the front of thigh, we have Quadriceps femoris, not Quadratus, but it is Quadriceps femoris, where it means quadra means 4, ceps means heads. So it is thought to be a single muscle, and it has 4 heads. But some other call each of these muscles as separate muscle. So we have put both the Quadriceps femoris under a single heading, and we have named the 4 muscles also here. So you can take it as a single muscle, or you can take it as 4 muscles, because the origin of these muscles are different, but they all get inserted to this base of the patella here. So because they all come and get inserted to this base of patella, so it is thought to be the 4 heads which are coming and getting inserted to the particular point. So this is the Quadriceps femoris. This Quadriceps femoris has 4 parts, or the 4 muscles. The first one is called as the Rectus femoris. This is the muscle here which is present in the front of the thigh. This is called as the Rectus femoris. Then we have the Vastus lateralis. On the lateral side, this is the muscle which is called as the Vastus lateralis. Then we have the Vastus medialis on the medial side, and in between the lateralis and medialis, behind this Rectus femoris, there is Vastus intermedius. So if you cut this Rectus femoris, then you can see the Vastus intermedius. If you see this cross section, here you can see the Vastus lateralis, this is the Vastus medialis, this is the Rectus femoris, and behind this Rectus femoris is the Vastus intermedius. So these are the 4 muscles which are together called as the Quadriceps femoris. The third muscle is a small muscle. This is called as the Articularis genu. So there is a small muscle here which is called as the Articularis genu. And the 4th muscle is the tensor fascia lata. Tensor fascia lata we also study in the gluteal region. Some classify it as the muscle of the gluteal region, the superficial muscles which are the gluteus maximus and the tensor fascia lata, and some classify it under the front of thigh because it is on the side. Okay, so you can either take it as it is a common muscle, you can say, between the front of thigh and the gluteal region. So these are the 4 muscles which are part of the front of thigh. One is the Sartorius, the first muscle. Then we have the Quadriceps femoris, which include the Rectus femoris, Vastus lateralis, Vastus medialis, as well as the Vastus intermedius. Then there is a small muscle called as the Articularis genu, and then the tensor fascia lata, which is a common muscle between the gluteal region and the front of thigh. All these muscles are supplied by a single nerve. This is called as the femoral nerve. So all these muscles are supplied by the femoral nerve, and the arterial supply to all these muscles is by an artery called as the femoral artery, and the venous drainage is by the femoral vein. So everything is femoral here. All these muscles are supplied by the femoral nerve, femoral artery, and these are drained by the femoral vein. So now we'll study these muscles one by one in detail. The first muscle is the Sartorius. So here you can see the whole muscle. This is the Sartorius muscle. This is said to be the longest muscle in the body. So as I said before, so all the structures in the lower limb are bulkier, thicker, larger, longer, thicker, everything. So so whatever you want to see, the thickest muscle, the sciatic nerve, will be present here. The longest and the thickest bone here, you can see the femur, and here the longest muscle is also present here. The longest nerve is present here. So all these longest, thickest, biggest will be present in the lower limb compared to the upper limb. Okay, so this is the longest muscle in the body, and it is an example for the ribbon or strap muscle. It looks like a ribbon tape. Okay, it looks like a ribbon, or it is looks like a strap, and that's why it is also called as the tailor muscle. This is also called as tailor muscle because it looks like the tape of a tailor, or it looks like a strap or ribbon, or the actions of this muscle help in sitting, the squatting position of a tailor who is to sit on the floor in traditional system. In that time, the movement which are needed for the squatting on the floor, that will be done by this Sartorius muscle. That's why it is also called as the tailor muscle. The origin of this muscle is from a structure here. This is called as the anterior superior iliac spine. This is the iliac crest. The most anterior part of the iliac crest is called as the anterior superior iliac spine. So this is the point where this muscle take origin. So it takes origin from the anterior superior iliac spine. Here also you can see this is the anterior superior iliac spine, and it get inserted to the upper part of the it gets inserted to the upper part of the medial surface of the shaft of the femur. It crosses the hip joint and the knee joint, then it goes down and get inserted to the medial side of the tibia. And along with this muscle Sartorius, there will be also a muscle called as gracilis as well as semitendinosus. All these three tendons will be inserted at this particular point. So this is the medial side of the shaft of the tibia. Okay, so this is the long muscle which take origin from the anterior superior iliac spine and get inserted to the medial side of the tibia. While it crosses the knee joint, it also gives some fibers to the capsule of the knee joint above and the crural fascia below. So this muscle gives some fibers even to the capsule of the knee joint. Nerve supply, as you know, is by the femoral nerve. The root value is L2 and L3, and the actions are, one is the flexion of the thigh. Even though this muscle is in the extensor compartment, it helps in flexion of the thigh and the flexion of the leg, and abduction of the thigh and the lateral rotation of this thigh. So even though it is present in the extensor compartment of the thigh, anterior compartment is also called as the extensor compartment here, but it actually flexes the knee joint as well as the hip joint, and also it helps in the abduction of the thigh as well as the lateral rotation of the thighs. This combination of four movement is done when you sit on the floor in the squatting position. So the traditional tailors used to sit on the floor and they used to do all their cuttings. So that's why it is also called as the tailor muscle, because for the tailor to sit on the floor or squatting position, these are the four actions needed, and these are done by the Sartorius. Now coming to the second muscle, that is the Quadriceps femoris. As I said, Quadriceps femoris has four muscles. The first one is the rectus femoris, which is the most anterior. Here you can see here the rectus femoris. Here you can see the cut section of the same. So this is a fusiform in shape, and superficial fibers are bipinnate and deep fibers are straight. If you see here, the superficial fibers, bipinnate means they are in two directions. The fibers, if you can see here, they are in two different directions. This is called as the bipinnate. So the superficial fibers are bipinnate, and if you see the deep fibers, they are straight. The origin of this muscle is from the anterior inferior iliac spine. So it has two heads, the straight head as well as the reflected head. The straight head takes origin from the anterior inferior iliac spine. So if you see here, the Sartorius take origin from the anterior superior iliac spine, and this straight head of the rectus femoris take origin from the anterior inferior iliac spine. And the reflected head takes origin from the groove above the margin of the acetabulum as well as the capsule of the hip joint. So near the acetabulum behind, just above the margin of the acetabulum as well as from the capsule of the hip joint, this reflected head of the rectus femoris will take origin. So it has two heads. One head, straight head, takes origin from the anterior inferior iliac spine, and the reflected head from the groove above the acetabular as well as the capsule of the hip joint. The insertion of this muscle, as I said, all this muscle of the quadriceps femoris will get inserted to the base of the patella. If you see here, this is the patella. It is almost pyramidal in shape with the base directed upwards here, and the apex is directed downward. So this is a reverse pyramid like structure. So the base is on the top here. Okay, so this will get inserted to the base of the patella. Nerve supply, as you know already, it is by the femoral nerve. Root values L2, L3 and L4, and the actions are, one is, as you know, the extension of the knee joint, as you know, because it is the muscle of the external compartment, so it indicates that it is the extensor of the knee joint. So it helps in the extension of the leg, and also a weak flexor of the hip joint. So it flexes the hip along with the iliopsoas, as well as maintains erect attitude with extensors. Coming to the second muscles of the quadriceps femoris, that is the vastus lateralis. So this is the muscle which is on the lateral side. Here on the other side, this is the vastus lateralis. So this is the largest of the quadriceps muscle, even though it looks very small here. If you see the cross section, then you can appreciate how big it is. So this is the cross section, and here you can see with the first muscle you have studied is the rectus femoris. Now you can see this is the vastus lateralis. This is the lateral side, this is the femur here. So this is the vastus lateralis, this is the vastus intermedius, and this is the vastus medialis. So this is the vastus lateralis. See the size of the muscle. So this is the largest of the quadriceps muscle. This here, it looks small because it is totally covered by the rectus femoris. So the origin of this muscle is from the upper part of the intertrochanteric line. So where is this intertrochanteric line? We'll see this picture and then we'll appreciate this. Okay, so if you see here, this is the greater trochanter of the femur and this is the lesser trochanter. In the front we have something called as the intertrochanteric line, the line extending from one trochanter to the other trochanter. So this is called as the intertrochanteric. Inter means between the trochanters. So in the front, if you see from the front of the femur, so you can see a line between the two trochanters. This is called as the intertrochanteric line. If you see from behind, at the same point from behind, so at that time you can see a projection between the two trochanters. This is called as the intertrochanteric crust. So you should be able to differentiate between the intertrochanteric line and the crust. Intertrochanteric line can be seen from the front and the intertrochanteric crust can be seen from behind. This is the view taken from behind the femur. Okay, so this muscle will take origin from the upper part of the intertrochanteric line, from here, the upper part of the trochanteric line. Appreciate this with this picture here. Here they have shown you the origin of the vastus lateralis. So it takes origin from a part of the upper part of the intertrochanteric line, then also the anterior and inferior borders of the greater trochanter. Where is the anterior and inferior border of the greater trochanter? So this is the greater trochanter here. So this is the greater trochanter. Just below that will be the anterior. This is the anterior because this is anterior view, anterior and inferior. Below the greater trochanter, this is the inferior. So here you can see. So this is the anterior and inferior borders of the greater trochanter. Then the lateral lip of the gluteal tuberosity. So where is this gluteal tuberosity? If you proceed backwards, then you can come along a line here. This is a small projection. This is called as the gluteal tuberosity. So this is the gluteal tuberosity where the gluteus maximus is inserted. Actually, if you see the gluteus maximus, 3/4 of the muscle will get inserted to the iliotibial tract. Only a part, 1/4 of that will be getting inserted to the femur, and this is the point where it will be getting inserted. This is called as the gluteal tuberosity. So it extends along this line. So here you can see the same thing, the origin of the vastus lateralis. So it begins from the anterior side and goes behind, and this is the line along which it will be taking origin. Then the upper half of the lateral lip of the linea aspera. Where is the linea aspera? If you trace behind, there is a posterior border very clearly prominent. This is called as the lineal aspera. So this is the linea aspera, which has a lateral margin, a medial margin. So this muscle will be taking origin along this line also. So it will be taking origin along the lateral margin or the lateral lip of the linea aspera. Then the tendon of the gluteus maximus as well as the lateral intermuscular septum. So because the gluteal tuberosity, there is the tendon of the gluteus maximus, that's why this muscle also takes from the origin from the tendon of the gluteus maximus as well as the intermuscular septum. If you can see here, this is the intermuscular septum. This is nothing but the modified deep fascia which separates the anterior compartment from the posterior compartment. This is called as the lateral intermuscular septum. So this muscle also takes origin from the lateral intermuscular septum. So this is a very big origin. It takes origin from the upper part of the intertrochanteric line, then the anterior and inferior border of the greater trochanter here. Then it also takes origin from the gluteal tuberosity here, and then it also extends below on the lateral lip of the linea aspera, as well as small origin is also from the tendon of the gluteus maximus as well as the intermuscular septum. This is the lateral intermuscular septum. So this has a very big origin. This is the vastus lateralis. Now coming to the insertion, as you know, it again get inserted to the base of the patella. If you can see here, this is the patella, this is the base of the patella, and you can see here this is the rectus femoris which is getting inserted, and here is the vastus lateralis. So it get inserted to the lateral 2/3 of the base of the patella, as well as even on the upper 1/3 of the lateral border. This is the lateral border of the patella. Okay, this is the medial border here, this is the lateral border. It not only gets inserted to the base of the patella, 2/3 of the base of the patella, but also on the upper 1/3 of the lateral border of the patella. And some of the fibers also go to the capsule of the knee joint, tibia as well as the iliotibial tract. So this is about the insertion of this vastus lateralis. Now coming to the nerve supply, as you already know, nerve supply is by the femoral nerve, and the actions also you know, that is the extension of the leg or extension of the knee joint. Now coming to the third muscle, that is called as the vastus medialis. The origin of this muscle is from the lower part of the intertrochanteric line, just opposite to that of the vastus lateralis. So vastus lateralis will be taking origin from the upper part of the intertrochanteric line. Now this will take origin from the lower part of the intertrochanteric line. If you can see here in this picture, this is the origin of the vastus medialis, just opposite toward the vastus lateralis. So it takes origin from the lower part of the intertrochanteric line. Then it also takes origin from the spiral line. So this intertrochanteric line will continue behind as the spiral line. If you can see here, this is called as the spiral line, or it is also called as the pectineal line, because the pectineus muscle will get inserted to this point. So that is called as the pectineal line, or it is also called as the spiral line. Okay, because it is spirally placed. Okay, so this is the origin. Then it also take origin from the medial lip of the linea aspera. So the vastus laterally was taking origin from the lateral margin. Now this will continue below from the medial margin. So it is just opposite to the vastus lateralis origin. And the upper 1/4 of the medial supracondylar line. So it also continues below up to here, and it takes origin even from the upper 1/4 of the medial supracondylar line. and the tendons of the adductor longus and magnus and the medial intermuscular septum. So all these muscles are present here. So it takes origin from the tendons of all these muscles, that is the adductor longus, magnus, as well as the medial side of the intermuscular septum. So this is the origin of this muscle. Okay, so from the lower part of the intertrochanteric line, then it continues behind from the spiral line. Here you can see here it continues behind in the spiral line, then it continues on the medial lip of the linea aspera. So it will continue in the medial side. You can see here this is the origin of the vastus medialis, and it continues below and it goes up to the supracondylar line. So it has a very big origin. This is the vastus medialis. Now coming to the insertion, as you already know, it get inserted to the base of the patella, but on the medial side. Okay, so medial 1/3 of the base of the patella, then also on the medial border, almost 2/3 of the medial border of the patella. Vastus lateralis get inserted to only 1/3 of the lateral border of the patella, but here the vastus medialis get inserted almost 2/3 of the medial border of the patella. This has a very important significance, that it prevents the lateral dislocation of the patella. Okay, that's the importance of being 2/3 inserted to the medial border. So it prevents the lateral dislocation of the patella. Usually whenever there is dislocation of patella, it will be on the lateral side. So this muscle, vastus medialis, will prevent the lateral dislocation of the patella. Along with that, some of the fibers also go to the capsule of the knee joint. So this is the insertion of this vastus medialis. Here we have to note here. So if you can see here, this the tendon of the quadriceps femoris. So all these muscles, the rectus femoris, vastus lateralis, medialis, as well as intermedius, all this will come and get inserted to the base of the patella, and this will continue below as the patellar ligament. And this patellar ligament will be getting inserted to the tibial tuberosity. There is something called as the tibial tuberosity on the anterior surface of the tibia, anterior and superior upper part of the tibia, that is called as tibial tuberosity, and this patellar ligament will get inserted to the tibial tuberosity. That's why it looks like 4 heads. All these get inserted here, and it continues as the patellar ligament get inserted to the tibial tuberosity. That's why it is called as the quadriceps. It is thought to be a single muscle. Okay, so this is the patellar ligament here, which is present. And coming to the nerve supply, as you already know, it is supplied by the femoral nerve, root value of L2, L3 and L4, lumbar second, third and fourth. And the actions you already know. One is the extension of the knee joint, that is the extension of the leg. Along with that, it also prevents lateral dislocation of the patella. As I said, the patella will be getting inserted on the medial border by 2/3 by the vastus medialis. That will prevent the lateral dislocation of the patella. So if you see the patella here, this patella is seen to be a bone within this tendon. So that's why it is called as the sesamoid bone. Sesamoid bone are those small bones which are within the tendon of the muscle. So this is said to be the largest sesamoid bone in the body. Okay, so this is the sesamoid bone. The patella is a sesamoid bone. The sesamoid bone is that bone which is within the tendon of any muscle. Okay, so the patella is said to be the largest sesamoid bone in the body. Now coming to the vastus intermedius, the last muscle of the quadriceps femoris. So the origin of this muscle is from the upper 3/4 of the anterior and lateral surface of the shaft of the femur. If you can see here, vastus lateralis take origin from this part, only small part here I am anteriorly, and the vastus medialis again from the medial side, very small part. But if you see the vastus intermedius, so it has a very big origin on the anterior surface as well as the lateral surface. If you see this picture of the cross section of the thigh, you can appreciate this is the femur. So you can see here it is taking, this is the vastus intermedius. It has a big origin from the anterior surface as well as the lateral surface. Okay, so that's what it has been said here. So this is the anterior surface and this is the lateral surface. So this vastus intermedius take origin from the upper 3/4 of the anterior and lateral surface of the shaft of the femur. So if you can see here, below it is 1/4 is deficient. Okay. So the lower part of the, this also take origin from the lower part of the lateral intermuscular septum. If you can see here, this is the lateral intermuscular septum. It also take origin, some of the fibers from the lateral intermuscular septum. Coming to the insertion, again this is also like any other quadriceps femoris, this also take get inserted to the base of the patella. Coming to the nerve supply, you already know femoral nerve, and the actions also you know, the extension of the knee joint, that is the leg. Now coming after the quadriceps femoris, the last muscle, that is called as the articularis genu. It is a very small muscle with few muscular slips behind the quadriceps femoris. If you see here in this picture, so this is the small muscle which is present in the lower 1/4 of the shaft of the femur. A very small muscle with few muscular slips behind the quadriceps femur. This is the quadriceps femur, big muscle with 4 heads, and this is small muscle, this is called as the articularis genu. So this will be taking origin from the anterior surface of the shaft of the femur, almost 2 inches above the patellar articular margin. Almost, if you measure from here, it will be almost 2 inches above the patellar articular margin. The insertion of this articularis genu is into the upper part of the synovial membrane of the knee joint, which bulges as suprapatellar bursa. If you see here, so this is the knee joint here, and there will be a small bursa here, actually a bursa which will be communicating with the knee joint. So this synovial membrane, which is in the knee, covering the knee joint, also covers the bursa, and this muscle will be getting inserted to the synovial membrane as well as into the suprapatellar bursa, and this prevents the kinking of this bursa into the knee joint during the movement of the knee. So prevents the kinking of the synovial membrane within the knee joint. So that's the importance of this small muscle called as the articularis genu. Coming to the nerve supply, as you know already, it is by the femoral nerve. So because this muscle is a very small muscle, the fibers to this muscle will be coming through the femoral branch, which will be supplying the vastus intermedius, because this is the vastus intermedius, big muscle here. So the fibers which come to here, they also come and descend and supply the articularis genu. So we'll discuss this again in detail when you study the femoral nerve. Coming to the action, as I said before, it pulls the synovial membrane upwards during extension of the knee. Now we'll study the femoral nerve. The femoral nerve, it is the chief nerve of the anterior compartment of the thigh. So each compartment has a nerve. Okay, so the chief nerve of this anterior compartment, that is the extensor compartment of the thigh, is the femoral nerve. So how it is formed? It is formed by the dorsal division of the anterior primary rami of the spinal nerves L2, L3 and L4. So if you can see here, so this is the lumbar plexus, and this is formed by the dorsal division of the anterior primary rami of the spinal nerves L2, L3 and L4. Okay, so if you can see here, these are the dorsal divisions, and the ventral division will be form the obturator nerve. The femoral nerve is by the dorsal division. You remember this, dorsal means posterior. As I said, the thigh has rotated and the posterior compartment has come to the anterior compartment. Okay, so that's why this compartment, even though this is the anterior compartment of the thigh, but it is supplied by the dorsal divisions of the anterior primary rami of the spinal nerves L2, L3 and L4. So that is the point you should remember, that the anterior compartment is supplied by the dorsal division, not the ventral division, like in case of the arm. In case of the arm, the anterior division is supplied by the ventral division and the posterior compartment is supplied by the dorsal division. So here the anterior compartment is supplied by the dorsal division. It is the largest branch of the lumbar plexus. If you see this is the lumbar plexus. This is the largest branch of the lumbar plexus. What are the branches and distribution it has? It will be giving the muscular branches as well as the cutaneous branches. This nerve will be divided into an anterior division and the posterior division. The anterior division will supply the Sartorius muscle, the long strap-like muscle, and the posterior division will be supplying the quadriceps femoris, that is the rectus femoris, and the three vasti, that is the lateral, intermediate, and medial vasti. Then it also supplies the small muscle in the thigh, that is called as the articularis genu. The cutaneous division, the anterior division gives rise to two cutaneous nerves, that is the intermediate and medial cutaneous nerve of the thigh, and the posterior division will give one cutaneous nerve, that is called as the saphenous nerve. If you feel this difficult, I have made it simple by putting this like this in this graphic form. So femoral nerve has an anterior division and a posterior division. The anterior division will be supplying one muscle, that is the Sartorius, and it will give two cutaneous branches, medial and intermediate cutaneous nerves. So anterior division will supply one muscle, Sartorius, and two cutaneous branches, medial and intermediate. The posterior division will be giving supplying all the other muscles of the anterior compartment, that is the rectus femoris, then the vastus lateralis, then the vastus intermedius, then the vastus medialis. So it will be supplying all these four muscles of the anterior compartment of the thigh. So when this nerves supply different muscles of this compartment, they also supply the joints. So the rectus femoris, if you see here, when it supplies the femoral nerve, when it supplies the rectus femoris, it will be giving some branches to the hip joint. The vastus lateralis, the nerve, the femoral branch which is supplying the vastus lateralis, it also gives branch to the knee joint. The vastus intermedius, the nerve which supplies the vastus intermedius, will be giving a branch to the knee joint as well as to the muscle that is called as the articularis genu. The vastus medialis, the branch of the femoral nerve which supplies the vastus medialis, also gives a branch to the knee joint. Now if you see here, all the muscles, when they are supplied by the branches of the femoral nerve, they all supply the knee joint except the rectus femoris which supply the hip joint. So in turn, the femoral nerve supplies both the hip joint as well as the knee joint. This posterior division also give a long cutaneous nerve. This is called as the saphenous nerve. This is said to be the longest nerve or the longest cutaneous nerve. This is the saphenous nerve. Okay, so that's why I have shown it in a lengthy fashion. Okay, so this is how you are supposed to remember. Femoral nerve, it has two division, anterior posterior division. Anterior division will supply one muscle and two cutaneous branches, medial and intermediate cutaneous branches, and the posterior division will be giving branches to the rectus femoris, and in turn this nerve also supply the hip joint. The branch which supply the vastus lateralis supply the knee joint. The branch which supply the vastus intermedius supply the knee joint as well as the articularis genu small muscle. The branch which supply the vastus medialis will also supply the knee joint. So it means all the branches which supply the different muscles also supply the knee joint except the branch to the rectus femoris which has supplied the hip joint. Along with that, there is also a nerve which is the cutaneous nerve of the posterior division, only cutaneous nerve from the posterior division, which is the longest nerve. It is said to be the longest nerve, which is nothing but the saphenous nerve. So this is about the femoral nerve. The articular branches, as I said, the hip joint is supplied by the nerve to the rectus femoris. Rectus femoris branch will be supplying the hip joint. The knee joint is supplied by the three vastus. So here in this picture, if you can see here, this is the femoral nerve, and this will be giving the anterior division and the posterior division, and you can see this is the posterior division and this is the anterior division. So the posterior division is giving branches. This is the rectus femoris branch and it supplies the hip joint, and these are the branches to the vastus lateralis. nerve to the vastus intermedius and medialis, which supply also the knee joint. And here you can see the medial and intermediate cutaneous branches from the anterior division, and the nerve to Sartorius. So this is what has been shown in this picture, explaining the same thing. The vastus medialis contain proprioceptive fibers from the knee joint. What do you mean by proprioceptive fibers? It is the sensation of the position of the joint. So whenever the brain has to give command for the joint to flex or extend or something like that, it should know what exactly is the position right now, the position. Because if the knee joint is already flexed and again the brain gives the command to flex, it cannot flex. Okay, and if the knee joint is already extended and again the brain gives the command to extend, it cannot extend. So the brain has to know before any movement what is the exact position of the joint. So these are called as the proprioceptive innervations. So these proprioceptive fibers for the knee joint are from the vastus medialis, nerve to the vastus medialis. This femoral nerve also gives vascular branches to the femoral artery and its smaller branches. And the main applied aspect related to the femoral nerve is whenever there are some disease of the hip joint, they will be referring the pain. Sometimes this pain of the hip joint will be referred to the knee, because as I said, the femoral nerve supplies both the hip joint as well as the knee joint. So because the femoral nerve supplies the hip joint and the knee joint, so if there is any disease in the hip joint, it is sensed as though that pain is coming from the knee joint, because the brain cannot differentiate between the pain coming from either from the hip joint or the knee joint, because it is supplied by the same nerve. Okay, so this is called as the referred pain. Even though the problem is in the hip joint, the pain is referred to the knee, so it senses as though it is coming from the knee joint. Okay, so this is because the same nerve, that is the femoral nerve, supplies both the joints, along with the obturator nerve, which is the nerve of the medial compartment, we'll study later. So that is also supplying both the hip joint and the knee joint. So these two nerves, femoral nerve and obturator nerve, will be having this referred pain. Okay, because both these nerves will be supplying both the joint, hip joint as well as the knee joint. Now let's discuss the femoral triangle. This is also called as the Scarpa's triangle. So this is the triangular which is present in front of the upper 1/3 of the thigh below the inguinal ligament. If you see in this picture, this is the inguinal ligament present here, and just below this inguinal ligament is a triangle present. This is called as the femoral triangle. So this is present in the upper 1/3 of the thigh, front of the thigh. So this is called as the femoral triangle. So this triangle, if you see, it is a reverse triangle with the base upwards and the apex downwards. So the base is toward the inguinal ligament. This is the inguinal ligament which extends from the anterior superior leg spine up to the pubic tubercle. This is the ligament here, a very important landmark, and this forms the base for this triangle, and the apex is directed downwards. So here also you can see this is the same triangle with the base upwards and the apex is directed downwards. So whenever it is a triangle, then there should be three boundaries. So what are the boundaries here? Laterally, we have the medial border of the Sartorius. We have studied the Sartorius. This is one of the muscles of the anterior compartment of the thigh. So this Sartorius muscle has a lateral border and a medial border. So the medial border of the Sartorius will form the lateral boundary. Okay. Similarly, medially, if you see here, there will be a muscle called as the adductor longus. In this picture, it has not been shown, but here you can see this is the adductor longus muscle. There is a muscle here. So the medial border of the adductor longus, not the lateral border, but the medial border of the adductor longus will also form the medial boundary. So medial border of the Sartorius, here is the medial border of the Sartorius, medial border of the adductor longus medially, and the base is formed by the inguinal ligament. As I said before, the base is formed by the inguinal ligament. These are the three boundaries of the femoral triangle: base by the inguinal ligament, laterally by the medial border of the Sartorius, and medially by the medial border of the adductor longus. The apex, as I said before, it is directed downwards, but it is not sharp, but it is blunt, and it will be continuing below as a canal. This is called as the adductor canal. Again, we will study the adductor canal in detail later. So you should know that the apex is not totally close, but it has an opening. It continues. The contents of this femoral triangle will continue, or the some of the contents will come through this canal into the femoral triangle. So this canal here which is present, this is called as the adductor canal. So the apex of this femoral triangle will continue as the adductor canal. Here you can see this is the femoral triangle, and it is continuing, the apex is continuing into the as the adductor canal. A roof is formed by the skin, then the superficial fascia. As you know, as soon as you reflect the skin, then you see the superficial fascia. Here in this superficial fascia, it is important because there are some very important contents. One is the superficial group of inguinal lymph nodes. So here is the inguinal ligament. So around that there are superficial inguinal group of lymph nodes. As you have already studied, there are medial and lateral, vertical, as well as the oblique group of lymph nodes which are superficial. Then deep to that there are also a deep inguinal group of lymph nodes. So here what you see in the superficial fascia will be the superficial group of lymph nodes. You can see here in the picture there are superficial group of inguinal group of lymph nodes. Along with that there is also femoral branch of the genitofemoral nerve. So if you see here, this is the femoral branch of the genitofemoral nerve. Along with that there is also a nerve which is called as the ilioinguinal nerve. So you can also see the ilioinguinal nerve, and superficial branch of the femoral artery with accompanying veins can also be traced here, as well as the upper part of the great saphenous vein. This is the very important vein which will be draining into the femoral vein. This is called as this is the superficial vein, great saphenous vein, which has a lot of clinical importance, especially in case of the varicosity of this vein, especially in people who stand for a very long time. That is called as the varicose vein. So this is the great saphenous vein which is opening into a opening called as the saphenous opening, and it is covered by the cribriform fascia. Here there will be a fascia or over this opening that will be called as the cribriform fascia, and this opening is called as the saphenous opening, and through this opening the great saphenous vein will be opening into the femoral vein. Coming to the floor is formed by four muscles. In this picture you can appreciate the four muscle. The floor is formed by the adductor longus itself. Adductor longus not only form the boundary, the medial border of the adductor longus form the medial boundary. Along with that, this muscle also form the floor of this triangle. The second muscle is the pectineus. Here you can see here, this is the pectineus. Then there is the tendon of the psoas major, and then we have the iliacus. The psoas as well as the iliacus together they are called as iliopsoas. Okay, so these are the four muscles which will form the floor of this triangle. So the adductor longus medially, then we have the pectineus on the lateral side, and lateral to that will be the tendon of the psoas major, and the most lateral will be the iliacus. These are the four muscles from medial to lateral side. So here you can see the psoas major muscle, and this is the iliacus which is coming from the iliac fossa. So these two together form a gutter like thing, and these two together are called as the iliopsoas. So it resembles a gutter lodging the fat profunda femoris artery and its medial circumflex branch of the femoral artery. So these are the two muscles which form a gutter, iliopsoas. Now coming to the content, why this triangle is so important. So it depends on the content. So what are the content? One is a very important artery that is called as the femoral artery. This is the femoral artery. In this picture you can see this is the femoral artery and its important branches, especially the median lateral circumflex femoral artery, profunda femoris artery, all these are the branches. So this is the femoral artery, which is again very important clinically, especially in case of the lower limb. You are supposed to examine, if they ask you to examine the pulsation of the femoral artery, this is the place where you are supposed to feel the pulsation just below the inguinal ligament. So this is the femoral artery here. Then the just medial to that is the femoral vein and its tributaries. So this is the femoral vein and its tributaries. The branches of the veins are called as tributaries because they will be draining into the larger vein. Okay. The third content is the femoral sheath. This, both the artery and the vein are covered by a modified deep fascia, which is called as the femoral sheath. So there will be a sheath around the structures. This is called as the femoral sheath. Then we can also trace some of the nerves. If you can see here, just beside the femoral artery, there is a very important nerve. This is called as the femoral nerve. So everything is femoral here. This is the femoral triangle, femoral artery, femoral vein, as well as the femoral nerve. So you can see here on the lateral side of the femoral artery is the femoral nerve. Apart from the femoral nerve, we can also trace the nerve to pectineus in this triangle, as well as the femoral branch of the genitofemoral nerve. We can also trace the lateral cutaneous nerve of thigh in this triangle. All these are the nerves which can be traced in this triangle. All these are not shown in this picture, but these are all nerves, the smaller nerves which can be seen. But you can see here the femoral nerve, other nerves will also be present. The deep inguinal lymph nodes can also be traced. We have seen that in the superficial fascia we have the superficial group of inguinal lymph nodes. Now in the deep fascia, deep to the deep fascia, we can also trace the deep inguinal group of lymph nodes, which are clinically again very important. These lymph nodes will be draining the lower limb. As we said, the femoral sheath will be present in the femoral triangle. It is a funnel-shaped fascial sleeve enclosing the upper 1.5 inches of the vessel. If you see in this picture, so this is the femoral artery and the femoral vein, and these are covered by something called as the femoral sheath, which is nothing but a fascial sleeve. How it is formed? It is formed by downward extension of the abdominal fascia. The anterior wall by the fascia transversalis and the posterior wall by the fascia iliaca. If you see the picture here, in this, if you can see here, this is the picture of the longitudinal section of the abdomen and the pelvis. Here this is the anterior abdominal wall. So these are the abdominal contents here, and this is the genital region. And if you see here, behind the anterior abdominal wall muscle, we can see a fascia here. This is called as a fascia transversalis, and behind we have the fascia iliaca. These two will come down and descend as the femoral sheath. Okay, so this is the fascia transversalis, which is supposed to form the anterior wall for this femoral sheath, and the posterior wall is formed by the fascia iliaca. So here you can see the posterior wall is formed by the fascia iliaca. These two fascias will descend down into the pelvis and actually into the upper limb in the deep to the deep fascia, and then you can see this as the continuation into the femoral triangle as the femoral sheath, and this will be covering some of the important structures like the femoral artery and the femoral vein. If you see the shape of this femoral sheath, it is funnel shape. Its lateral wall is vertical and medial wall is oblique. If you see the next picture here, if you can see here, this is how it looks like. So here are the structures inside that, and these structures are covered by this fascial sleeve. So the lateral wall is vertical, so this is the lateral wall, and the medial wall is almost oblique. So this is what is mentioned here. So its lateral wall is vertical and the medial wall is oblique. So that's why it looks like a funnel. It is funnel shape, and it is directed downwards as well as medially, depending on the shape. The size of this femoral sheath is, as I said, it is almost 1.5 inches or 3 to 4 centimeters in length. And this is how it looks like when we take a cross section of the abdomen as well as the pelvis and the upper limb, and then you can see this is how this facial sheath will look like after skin superficial fascia dysphagia deep to that. In case of the just below the inguinal ligament, this is how it looks like. So this sleeve, facial sleeve, or the femoral sheath is divided into 3 compartments by 2 vertical septas. So if you can see here, this is the cross section of this is the femoral sheath, and if you take a cross section, this is how it looks like with all its contents. So here you can see there are 2 vertical septas which divide this whole of the sheath into 3 compartments. The first or the most lateral compartment is also called as the arterial compartment, consists of the femoral artery. Because of the femoral artery presence, that's why it is called as the arterial compartment, or it is because it is on the lateral side, that's why it is called as the lateral compartment. Here also you can see the same structures. Here is the femoral artery. Along with the femoral artery, there is also a nerve which is called as the femoral branch of the genitofemoral nerve. So this is the nerve which you are seeing, femoral branch of genitofemoral nerve. Here also you can see the cross section, the femoral artery, along with that is the femoral branch of the genitofemoral nerve. So this is in the lateral compartment. The second compartment medial to that is the intermediate compartment, or it is also called as the venous compartment because of the presence of the femoral vein. Here you can see here again this one. So here you can see this is the femoral vein. So this femoral vein is present in the intermediate compartment, also called as the venous compartment. The most medial compartment is empty. So this is almost empty except a few group of lymph nodes. So this is also called as the medial compartment, or also called as lymphatic compartment because of the presence of small group of lymph nodes. Even though this is empty, this compartment is empty, but this is the most important compartment of all these 3 because this is clinically important. This compartment is also called as the femoral canal, and here, as I said, you can see small group of lymph nodes, half into half inches of size lymph nodes, also called as the lymph nodes of the Rosenmuller or lymph nodes of the Cloquet, along with lymphatics and small amount of areolar tissue. That's what you can see here, small quantity of fat along with the small group of lymph nodes. But why it is important? Because this is the potential space, and weakness of this area leads to the clinical conditions called as the femoral hernia. The abdominal contents, as you can see in the previous picture, so these fascia are coming from the abdomen. Fascia transversalis and the fascia iliaca are from the abdomen. So when they become weak, so the abdominal contents like the intestine, the bladder or something like that also descend along this route, especially in the most medial compartment, which is also called as the femoral canal, because it is almost empty. In other compartments we have the artery, vein, everything, they are totally occupying these areas, but here because it is empty, almost empty, with small group of lymph nodes and fat, so this becomes the potential space for the protrusion of any abnormal protrusion of the abdominal contents through the abdomen into the femoral femoral canal, and this leads to conditions called as the femoral hernias. So these are the three compartments of this femoral sheath. Now let's discuss the back of the thigh. The other name for the back of thigh is the posterior compartment of thigh, or it is also called as the flexor compartment of thigh, or also called as the hamstring compartment. So back of thigh or posterior compartment of the thigh, or depending on the action, it is also called as the flexor compartment, or it is also called as the hamstring compartment. This compartment consists of three muscles. They are semitendinosus, semimembranosus, and biceps femoris. These are the three muscles which are present in this compartment. If you see this picture here, you can see this is the cross section of the thigh. This is the femur. So this is the anterior compartment of thigh. This is the posterior compartment of thigh, and this is the medial compartment. What we are discussing is this compartment. So this compartment has three muscles: semimembranosus, semitendinosis, and biceps femoris. So these three muscles are called as hamstring muscles, and these muscles are supplied by the perforating branch of the profunda femoris artery, which in turn is a branch of the femoral artery, and the nerve supply is by the tibial part of the sciatic nerve. And as the name indicates, the flexor compartment, so this compartment has the three muscles which have the same action. All three muscles have the same action, that is the flexion of the knee joint. So you should remember, it flexes the knee joint. Before we study these muscles in detail, some of the important points to be remembered, which are in general common for all the three. One is, all the muscles of this compartment take origin from something called as ischial tuberosity. So this is the hip bone or innominate bone, this is the ilium part, this is the pubis, and this is the ischium. So there is a prominent part here, this is called as the ischial tuberosity. So all the three muscles of this compartment take origin from this part of the ischial tuberosity. So if you see the superior-medially, this will be for the origin of the semimembranosus, and below it will be for the origin of the semitendinosis as well as the biceps femoris. So all the three muscles will take origin from the upper part of the ischial tuberosity. All these three muscles cross both the joints, that is the hip joint as well as the knee joint, and hence they have action on both these joints, hip joint as well as the knee joint. And these muscles will get inserted either on the tibia or the fibula. So they cross the knee joint and then descend downwards and either get inserted to the tibia or the fibula. So they cross both the hip as well as the knee joint. The importance is that they have action on both the hip joint as well as the knee joint. As the name indicates, they act as the chief flexors of the knee. So the main action will be on the knee, and they act as the chief flexor depending on the name, flexor compartment. But apart from that, because it also has action on the hip joint, that is secondary movement, they act as the weak extensors of the hip. The main action, the chief action of this muscle will be on the knee, and they act as the chief flexors of the knee. Apart from that, they also are weak extensors of the hip joint. All these three muscles are supplied by the tibial part of the sciatic nerve. If you see here, so in this picture you can see this is the sciatic nerve. So this is the lumbosacral plexus or sacral plexus, which begins from L4, L5 and ends at S3. So if you see here this nerve has been colored in two colors here. So this is the whole nerve is sciatic nerve. This is the common peroneal nerve or fibular nerve, and this is the tibial part of this sciatic nerve. So the tibial part of sciatic nerve will be supplying these three muscles of the posterior compartment of the thigh. The blood supply is from the profunda femoris artery. So these are some of the important general points for the muscles of the posterior compartment of thigh, that is the hamstring muscle. To begin with, the first muscle to study in detail, the first muscle will be the semitendinosus. This is called so because of a long tendon and a short belly. If you see this muscle here, you can see, as soon as you can see a long tendon. Actually, it should be still longer. It will have a very long tendon and a short belly. Okay, here the belly has been shown much larger, but the belly will be much smaller actually, and it will have a long tendon. So depending on the shape of this muscle with a small belly and a long tendon, so that's what is called as semitendinosis. This muscle will be posterior-medial. So this is the medial part, this is the lateral part. Okay, so this will be behind because it is belong to the posterior compartment, as well as it is medial. So it is posterior-medial in the thigh and superficial to the semimembranosus. If you see deep inside, you can see this is the semimembranosus. Okay, so this is superficial to the semimembranosus. This is the semitendinosis. Origin of this muscle, as I said before, all these muscles will be taking origin from the ischial tuberosity. So this also takes from the ischial tuberosity. So this will be taking origin from the inferomedial impression of the ischial tuberosity. If you remember this picture, so it will be taking origin from the inferomedial part. So inferomedial part of the ischial tuberosity, along with the long head of the biceps. This is the long head of biceps. The biceps femoris has two parts, two heads. So this is the long head. So here this is the long head, and the short head will be on the other side, deep inside. So this is the long head. Long head of biceps femoris as well as the semitendinosus, they will take origin from the same point. That is the inferomedial impression of the upper part of the ischial tuberosity. The insertion of this muscle, semitendinosus, it descends, crosses the hip joint as well as the knee joint, and goes toward the medial side of the tibia and get inserted to the medial surface of the tibia behind the Sartorius and the gracilis. Along with the gracilis as well as the Sartorius, it will get inserted to the medial side of the tibia. This is the insertion. So origin from the ischial tuberosity, and insertion will be into the medial side of the tibia. Nerve supply, as you already know, it will be from the tibial part of the sciatic nerve, the root values being L5, S1 and S2. The actions, as you already know, it is the chief flexor. This is one of the chief flexors of the knee. Along with that, as I said before, it also acts as the weak extensor of the hip joint. Apart from these two actions, in case of semi-flex knee, it also acts as a medial rotator of the leg. In case of semi-flex knee, it also acts as the medial rotator of the knee joint or the leg. Not exactly at the knee joint, it will be at the hip joint itself, but it will be medial rotation of the hip joint or the thigh. And when the hip is extended, in that case, it will be acting as the medial rotator of the thigh itself. The second muscle here will be the semimembranosus. As the name indicates, it looks like a membrane because it has a flat tendon. If you see here, so it is a flat muscle compared to the semitendinosus. It is a long tendon with a small belly, but the semimembranosus is broader. It is flat, it has a flat tendon of origin, and it is a flat muscle. And this muscle will be, that's why it is called as semimembranosus. It looks like a membrane, and it is posterior medial to the posterior medial in the thigh, as well as it will be deep to the semitendinosus. This semitendinosus, deep to that will be the semimembranosus. origin of this muscle, as I said before, it will be from the ischial tuberosity, but the superior lateral part of the ischial tuberosity. Insertion will be to the groove on posterior surface of the medial condyle of the tibia. So it will be into the groove on the posterior surface of the medial condyle of the tibia, just below the as well as medial to the condyle of the tibia will be the insertion of this muscle. If you can see here, so this is the same muscle, semimembranosus, taking origin with a flat tendon and going down and crossing the hip joint as well as the knee joint and get inserted to the medial condyle of the tibia. Expansion from the oblique popliteal ligament and fascia covering the popliteus, and also go to the upper part of the medial border of the tibia. So this muscle not only get inserted to the medial side of the medial condyle of the tibia, but also some of the fibers will go to the oblique popliteal ligament as well as the fascia covering the popliteus. So there will be so if you can see here, so this is the part of the semimembranosus that get inserted to the capsule of the knee joint along with the so here will be also the oblique popliteal ligament and the fascia covering the popliteus. So it get inserted not only to the medial condyle but also to the some of the fibers go to the capsule as well as the oblique popliteal ligament around that. Coming to the nerve supply, it will be by the tibial part of the sciatic nerve with the root values L5, S1 and S2. Actions, as you know already, the chief flexor of the knee as well as the weak extensor of the hip. Apart from that, in case of semiflex knee, it acts as a medial rotator of the leg, because it is this semitendinosis as well as semimembranosus is on the medial side, so it acts as the medial rotator of the leg. And when hip is extended, it acts as the medial rotator of the thigh itself. So these are two additional actions of this muscle, semimembranosus. Coming to the last muscle in this posterior compartment of the thigh, that is the biceps femoris. As I said before, this will have two heads. One is the long head, which begins from the ischial tuberosity, and a short head which take origin from the shaft of the femur, the posterior part of the shaft of the femur, that is the linea aspera. And this will be on the posterior lateral side of the thigh. So these two muscles on the posterior medial side of the thigh, this long head of the biceps femoris will be on the lateral side, posterior lateral in the thigh. The origin, as I said before, the long head will be taking origin from the inferomedial impression of the ischial tuberosity along with the semitendinosis, and also from the lower part of the sacrotuberous ligament. So here, if you can see here, this is the sacrotuberous ligament which extends from the sacrum to the ischial tuberosity. So it not only takes origin from the ischial tuberosity itself, but also from the sacrotuberous ligament which is there. The long head, this is about the long head. The short head will be taking origin, as I said, from the lateral lip of the linea aspera. Linea aspera is the posterior border in the femur, in the shaft of the femur. So this muscle short head will be taking origin directly from the lateral lip of the linea aspera between the adductor magnus as well as the vastus lateralis, from the upper 2/3 of the lateral supracondylar line and from the lateral intermuscular septum. This is the origin of the short head, not only from the linea aspera but from the upper 2/3 of the supracondylar line. Above the condyles, the supracondylar line, so it also takes origin from the supracondylar line as well as the lateral intermuscular septum, the septum which separates the posterior compartment from the anterior compartment, that is called as the lateral intermuscular septum, which is nothing but the modified fascia of the thigh. Coming to the insertion, this also crosses the hip joint as well as the knee joint and descend downwards, and the tendon is either folded around or split by fibula collateral ligament and is inserted into the head of the fibula in front of its apex, which is called as the styloid process. If you see here, this is the head of the fibula, this is the tibia here, this is the fibula. So this is the head of the fibula and it has styloid process. Just near beside this styloid process, this will get inserted. So this is the biceps femoris, which will be getting inserted to the styloid process or the apex of the fibula near the head of the fibula. So this is about the origin as well as the insertion of this biceps femoris. Now coming to nerve supply, the nerve supply is slightly different here. The long head is supplied by the tibial part of the sciatic nerve like other muscles, but the short head is supplied by the other part of the sciatic nerve. So if you see here this sciatic nerve, this is the sciatic nerve which descends from the gluteal region into the thigh and it is present in the posterior compartment. So most of the muscles here are supplied by the tibial part. It divides into tibial part as well as the common fibular part or peroneal part. So this all these three muscles are supplied by the tibial part of the sciatic nerve, but only the short head will be supplied by the common peroneal part of the sciatic nerve with the root values L5, S1 and S2. So this is the only difference in the nerve supply among these three muscles. Coming to the actions, just like the other muscles, this muscle also acts as the chief flexor of the knee. Apart from that, it also acts as the weak extensor of the hip. And apart from these two actions, main actions, in case of semi-flexed knee, because it is present on the lateral side, it is a lateral rotator of the leg. And when the hip is extended, it also acts as the lateral rotator of the thigh. So these are some of the actions of this muscle, that is the biceps femoris, which is having two heads, the long head as well as the short head. Now let's discuss the sciatic nerve. As we have seen, this is the largest branch of the sacral plexus, and this is the nerve which will be supplying the posterior compartment of the leg, that is the hamstring compartment. And this is the thickest nerve in the body, almost 2 centimeters in thickness. As soon as you see this nerve in the gluteal region as well as in the back of thigh, just because of the thickness you can easily identify this sciatic nerve. Such a thick nerve is this nerve. This is the thickest nerve in the body itself. It begins in the pelvis and terminates at the superior angle of the popliteal fossa by dividing into tibial as well as the common peroneal nerve. If you have seen this picture, so this is the sciatic nerve. This is coming from the gluteal region and descending all the way into the posterior compartment of thigh, and it goes along the thigh muscles and just above the popliteal fossa. So this is the popliteal fossa. Just above the popliteal fossa, it divides into its two terminal branches, the sciatic nerve, the tibial nerve as well as the common peroneal nerve. So the sciatic nerve divides into the tibial nerve as well as the common peroneal nerve. Just at the superior angle of the popliteal fossa. So this is the sciatic nerve. The origin and root value of this nerve is, as you know, it begins in the sacral plexus, and the tibial part is formed by the ventral division of the anterior primary rami of L4, L5, S1, S2 and S3. So this is the whole sciatic nerve. This is the tibial part, and this yellowish part is the common fibular or peroneal part. So if you see the tibial part, the root values of this is from L4, L5, S1, S2 and S3. All these 5 will be contributing, especially the ventral divisions of the primary rami. You should remember this is formed by the ventral division, but the common fibular is formed by the dorsal division of L4, L5, S1 and S2. There is no contribution from S3. So this will be the root value for the tibial part and the common fibular part. For the tibial part, the root values will be L4, L5, S1, S2 and S3. For the common peroneal part or fibular part, it will be only L4, L5 and S1 and S2. There will be no S3. And also you should note that the tibial part is formed by the ventral division and the common fibular part is formed by the dorsal division of the anterior primary rami. This is the difference between the tibial as well as the common fibular or peroneal part. So in this picture also you can see all these nerves, and this is the formation of the sciatic nerve here. So the same is coming down. This is the sciatic nerve seen from behind. This is the origin of the sciatic nerve from L4, L5, S1, S2 and S3, which is the ventral and dorsal divisions joining together here, and then they descend as the sciatic nerve. So here the same thing is seen from behind, and this are the two divisions of the sciatic nerve. Branches. It will be giving articular branches to the hip joint, and the muscular branches, as we already seen, it will be supplying some of the muscles in the thigh, the posterior compartment of thigh, especially the semimembranosus, semitendinosis and long head of biceps femoris, which is supplied by the tibial part, and the short head will be supplied by the common peroneal part. And this tibial part also supply the ischial head of the adductor magnus, and the common peroneal part will be supplying the short head of the biceps femoris, as I said. Okay, so this will be the muscular branches in the thigh. Now let's discuss the last compartment, that is the adductor compartment of the thigh, or it is also called as the medial compartment of the thigh. So in this picture, if you see here, this is the anterior compartment, this is the femur here, this is the cross section of the thigh, the anterior compartment, this is the posterior compartment, this is the medial compartment, which is towards the medial side. The muscles of this compartment are 6 in number. One is the pectineus, second is the adductor longus, adductor brevis, adductor magnus, obturator externus, as well as the gracchalis. These are the 6 muscles which constitutes this compartment. So there are 6 muscles within this compartment. The nerve supply to all these muscles is by obturator nerve. So the nerve of this compartment is obturator nerve, and the main action of these muscles, as the name indicates, the adductor compartment. So all these muscles help in adduction of the thigh. So here we can see the picture where all the muscles of the adductor compartment can be seen. So here this is the adductor longus muscle, here is the adductor brevis. This can be seen much more clear. Here is the adductor brevis, and the behind the big muscle is called as the adductor magnus. In this picture, if you can see, the whole muscle is the adductor magnus with a lot of perforations for the branches of the deep artery of the thigh. And apart from that, you can also see the pectineus here, as well as this is the obturator externus. And the most medial here will be the gracchalis, which is not seen in this picture, but you can imagine here will be the presence of gracchalis. So these are 6 muscles of this compartment. Coming to the origin and insertion of these muscles, the first muscle is the adductor brevis. This muscle will be taking origin from so here you can see here, this is the adductor brevis. This will be taking origin from the pubis, from the inferior pubic ramus. So the pubis has 2 ramus, superior as well as the inferior pubic ramus. So this muscle will be, the adductor brevis will be taking origin from the inferior ramus of the pubis and get inserted to the medial ridge of the linea aspera. If you see here, so this muscle will go towards the femur and it gets inserted to the linea aspera on the medial ridge or medial lip of the linea aspera. The second muscle is the adductor longus. So here again, if you see here, this is the adductor longus muscle. So this will be taking origin from the front side of the pubic bone under the pubic tubercle. If you see here, so here will be the pubic tubercle, this is the pubic crust, this is the pubic symphysis between the two bones. So this is the pubic tubercle. Just below the pubic tubercle, it will be taking origin from the body of the pubis. And the insertion will be again to the medial ridge of the linea aspera. So this muscle also get inserted to the medial ridge of the linea aspera. This is the adductor longus muscle here. This is the adductor brevis and this is the longus. The adductor longus is in the front and due to that is the adductor brevis. Then the third muscle, that is the adductor magnus. As the name indicates, it is huge muscle, big muscle, and it has a very big insertion. So this muscle will be taking origin from the inferior pubic ramus as well as the tuberosity of the ischium. So if you see here, so this is the inferior pubic ramus. As I said, it has the pubis has two rami actually. When it is plural, it should be rami. So superior pubic ramus as well as the inferior pubic ramus. So this muscle magnus will be taking origin from the inferior pubic ramus as well as from the inferior the ramus of the ischium, as well as the small part even to the, it goes up to the tuberosity of the ischium. So this ramus is called as the ischiopubic ramus. So this muscle will be taking origin from this ischiopubic ramus, and the insertion will be again to the medial ridge of the linea aspera and the adductor tubercle. It extends all the way from above downwards from the on the medial lip of the linea aspera, and it goes all the way up to, there is a very prominent tubercle here that is called as the adductor tubercle. Because this the adductor magnus is attached to this, that's what is called as the adductor tubercle, and this muscle will be getting inserted all the way in the linea aspera from above downwards and goes up to the adductor tubercle. The next muscle is the pectineus. The pectineus, as you can see here in this picture, this is the pectineus muscle. This will be taking origin from the pectineal line as well as get inserted to the pectineal line. So here, if you can see here, there is a line here on the pubis. This is called as the pectineal line. So this muscle will be taking origin from this pectineal line, as well as it get inserted to one more pectineal line which is present in the femur, which is also called as the spiral line. So it get inserted to the spiral line, or it is also called as the pectineal line. So it takes origin from the pectineal line of the hip bone and get inserted to the pectineal line of the femur, or the spiral line of the femur. Coming to the gracchalis, as I said, it will be the most medial muscle here. It will be present here on either side, or here it will be present. So this muscle will be taking origin from the inferior pubic ramus, as you can see again. So it will be taking origin from here. So it will be the inferior pubic ramus and get inserted to the tibia. There is something called a pes anserinus on the tibia. So it get inserted to the tibia, medial side of the tibia. Okay. Then coming to the last muscle, that is the obturator externus. So this is the obturator externus. This will be taking origin. Here there will be a foramen called as the obturator foramen. So it is covered by a membrane called as the obturator membrane, and this muscle will be taking origin from the obturator membrane. So this muscle, as I said, obturator externus, will be taking origin from the lateral surface of the obturator membrane. From the medial surface, there is one more muscle taking origin, that is called as the obturator internus. Okay, so this will be taking origin from the lateral surface of the obturator membrane, which is present on the obturator foramen, and it also takes origin from the ischiopubic ramus. Some part will be also taking origin not only from the foramen, the membranes of the foramen, but also a small part from this ischiopubic ramus. This is called as the ischiopubic ramus. So it will be taking origin from the ischiopubic ramus and get inserted to the trochanteric fossa in the greater trochanter. If you can see, this will be going behind and get inserted to the the trochanteric fossa in the greater trochanter. This is the greater trochanter of the femur, this is the lesser trochanter of the femur. So it get inserted to the greater trochanter of the femur. So this is about the origin and insertion of this muscle, and you know already the nerve supply is by the obturator nerve, and the action is the adduction of this thigh. Now coming to the obturator nerve, which will supplying this compartment, that is the adductor compartment. So the obturator nerve, as I said, is the chief nerve of the adductor compartment or the medial compartment of the thigh. And the formation, you can see here, this is a picture which shows the formation. This is the lumbar plexus and you can see the formation of the femoral nerve here. So this is from the root values of L2, L3 and L4. Similarly, the origin of the obturator nerve is also from the same root values L2, L3 and L4. The only difference between these two is this obturator nerve is formed by the ventral division and the femoral nerve is formed by the dorsal division. So dorsal means posterior. So the actually, even though the femoral nerve supplies the anterior compartment of thigh, because the thigh has rotated and the posterior compartment of the arm is compared with the anterior compartment of the leg, so the nerves from the posterior compartment, the dorsal nerves, will be actually supplying the anterior compartment of the thigh. So that is by the femoral nerve, which is formed by the dorsal division. And the ventral division, ventral means anterior division, so this will be supplying the posterior compartment of the actually the medial compartment of the thigh, which has, again, as I said, because of the rotation, this will be the medial compartment will be supplied by the anterior division or the ventral division. So this obturator nerve, you should remember, is formed by the same root values as that of the femoral nerve L2, L3 and L4, but this is by the ventral division of the anterior primary rami of the spinal nerves L2, L3 and L4. What are the branches and distribution? So the branches, as you already seen, it will be supplying all the 6 muscles of the adductor compartment, that is the pectineus, adductor longus, brevis, magnus, as well as gracilis, as well as the obturator externus. And cutaneous branches, it will be supplying a small area on the medial side of the thigh. If you can see here, this is the area supplied by the obturator nerve on the skin. So this is the cutaneous supply of this obturator nerve. So here you can see this is the obturator nerve. This is the formation of the obturator nerve from the L2, L3 and L4. So these are the ventral divisions which are joined together from L2, L3, L4, going descending downwards into the pelvis, and from there supplying all the muscles of the adductor compartment. On the other side, you can see the dorsal division of from the L2, L3, L4, which form the femoral nerve, and it supplies the anterior compartment. And here you can see this is the cross section of the thigh, and you can see this is the medial compartment, and this is the gracilis muscle, which I was talking about, the most medial muscle. This is the gracilis muscle, which crosses the knee joint and get inserted to the medial side of the tibia. So these are the other muscles of the adductor compartment. This is the adductor longus, brevis, and behind will be the adductor magnus, and here you can see the pectineus, and here will be the obturator externus, which cannot be seen clearly here in this picture, but here you can see here this is the obturator externus. So this is about the muscles of the adductor compartment as well as the nerve supplying the adductor compartment. Now, apart from these muscles as well as nerve in the compartment, adductor compartment, there is also something called as the adductor canal. So this is also called as the subsartorial canal, or it is also called as the Hunter's canal. So if you remember the femoral triangle, this is the femoral triangle which is in the front of thigh. It has a base which is toward the inguinal ligament, and the apex directed downwards. So the apex is not totally sharp, but it is blunt, and it opens into a canal called as the adductor canal. So this is the adductor canal. So all the contents which are there in the femoral triangle, they will be either descending downwards, or some of the structures will be going upwards. So this canal will be connecting the femoral triangle with the popliteal fossa here. So the contents will be from the femoral triangle will be descending into the popliteal fossa, or the some of the structures from the popliteal fossa, they will be going into the femoral triangle. So the extent of this, as I said, this adductor canal extends from the apex of the femoral triangle to tendinous opening in the adductor magnus. In the adductor magnus, if you have observed before, there is a large opening here. This is called as the adductor hiatus. So here you can see here. So there is a large opening here. This is called as the adductor hiatus, and this is the opening of the adductor canal into the popliteal fossa. So it begins from the apex of the femoral triangle and it opens into the popliteal fossa through the adductor hiatus. The shape, it is almost triangular in shape when you take a cross section. So this is how it looks like. If you take cross section of this part, then you can see this is how the adductor canal will look like. So what are the boundaries? Because it is a triangle, so it should have three boundaries. The first boundary is the anterior boundary or the anterior wall, which is formed by the vastus medialis. So this is the muscle here which form the anterior boundary for this triangle. So this is the vastus medialis. Posteriorly, the floor is formed by the adductor longus muscle here, as well as the adductor magnus below. Okay, so this is the adductor longus which will be forming the floor above, and the adductor magnus will form the floor below. And medially, or towards the roof, there is a strong fibrous membrane stretching across the anterior and posterior walls, and over it lies the Sartorius. So there is a strong fibrous membrane stretching from the vastus medialis up to the adductor longus. Over that is the Sartorius, and in between these two there is something called as the subsartorial plexus of nerves. So if you can see here, there is a plexus. This is called as the subsartorial plexus between the Sartorius and this strong fibrous membrane. So what is the subsartorial plexus? This subsartorial plexus lies between the fibrous roof and Sartorius, and it is a plexus formed by branches from the medial cutaneous nerve of thigh, the saphenous nerve, as well as the anterior division of the obturator nerve. So these three nerves will be forming a plexus that is called as the subsartorial plexus. It supplies the overlying fascia lata as well as the neighboring skin. So it will not only supply the neighboring skin but also the overlying fascia lata. So this is the plexus which is present between the Sartorius as well as the strong fibrous membrane. So this is the roof of this triangle. So here again you can see here is the adductor canal which is connecting the femoral triangle with the popliteal fossa below through the adductor hiatus. So what are the contents of this adductor canal? One is the femoral artery, the second is the femoral vein. You can see in this picture the femoral artery in the cross section, and this is the femoral vein. Here you can see the femoral artery, and behind that is the femoral vein. Then the long saphenous nerve, and here also you can see in the cross section the long saphenous nerve. Then the nerve to vastus medialis. So here also you can see the nerve to vastus medialis, and two divisions of the obturator nerve. So here are the anterior and posterior divisions of the obturator nerve. So this is the structures viewed from the front, and this is the view of the same adductor canal when you take the cross section. So this is the arrangement of the structures in the adductor canal. So the femoral artery will be conveying from the femoral triangle into the popliteal fossa, and the femoral vein will be coming from the popliteal fossa as the popliteal vein and enters the adductor canal and continues as the femoral vein into the femoral triangle. Along with that, the saphenous nerve, nerve to vastus medialis, as well as two divisions of the obturator nerve can also be traced here. So this adductor canal is a very important passage for the structures from the femoral triangle into the popliteal fossa, and from the popliteal fossa back into the femoral triangle. Okay, so these are some of the important contents of this femoral adductor canal which make it so important. Coming to the last part, that is the applied aspects. The femoral artery is ligated in cases of the popliteal artery aneurysm. In these cases, if you see the femoral artery is to be ligated, uh, especially the popliteal artery is prone for the aneurysms, and it has to be tied. This is the area in the adductor canal where the femoral artery can be easily traced, and it can be easily ligated in this region. So this is one of the important applied aspect related to the contents of the adductor canal. The femoral artery, if it is to be ligated, and this is the site where it can be easily caught hold of, as well as it can be tied. So this is all about the adductor canal itself. So if you have any doubts, you can ask me. So thank you very much